Cell therapy today means the therapy mainly with fresh cells harvested from sheep fetus in order to treat chronically ill persons. Chronic pathologies are the main problem in modern clinics. In the last decades, cell therapies had been known for anti-aging purposes, but as we can see today, the therapy with fresh frozen cells is of greatest importance for any chronic disease, and this means for pathologies like Alzheimer's disease, like neurology deficiency pathologies, or illnesses that have to do with lack of hormones. So a very broad range of pathologies and disorders can be treated effectively and safe. Cell therapy works through different ways. Implanted, injected cells are taken up by white blood cells of the host's organism. They are transported, as we know from research and radio marking of the injected cells, to the organs that are in question. Cells work by different ways. After the injection, it could be shown that they have different ways of metabolism. The first and best known is the so-called homing. White blood cells take up the injected cells and bring them to the organ which has to be repaired, so to say. Another part of the injected cells stays where they are or where it is and is able to build up and to send so-called messengers. Less known is the fact that injected cells and metabolized cells from the sheep can emit photons which have an effect on the informative level. So, I repeat, on different levels we have repair effects that help to heal pathologically changed organ. Normally, after the injection, one can expect a benefit within 2, in some cases 4 or even 6 weeks, depending on the state of the patient, his age, and possibly other existing or comorbidities or therapies. Benefits usually will be felt by the patient through better energy, better capacity regards to the pre-existence pathology. That means a patient with heart failure, heart insufficiency, will feel improvement of his heart condition. So, and this could be proved by own studies, heart conditions like NYHA state 4 or 3 can be reduced to state 1 or 2. The same is valid for liver or kidney conditions. So kidney conditions that are not submit to dialysis can improve so that the patient can have a normal life for a long time. On the other side, in the area of anti-aging medicine, the benefits are manifold. Improved resistance, less fatigue, and regain of all-over strength in any situation of daily life can be expected. There is another aspect which should not be neglected. apart from the inside recovery and rejuvenation, patients and the persons around them will see a visible change. Due to the quality of the cells that we use in our clinics, we will find a change of the consistency, of the quality of the skin. This is certainly a consequence of the ingredients which stimulate the hormonal system of the patients, whether they are men or women. The skin, for example, will have a younger outlook, better vibrance and tension through improved collagen and elastin production. Furthermore, hair growth can be improved by local application of cells, for example, umbilical cord into the skin of the head. In some cases, special cell treatment is also possible for treating wrinkles and other traces of premature aging. The main question I am asked quite often: why do we recommend and why do we do cell therapy? To me, cell therapy offers a unique possibility of stimulating repair mechanisms that cannot be activated by any other method. The information given by the cell through its particles, for example mitochondria or other substructures, is highly effective and cannot be compared to any pharmacological, biochemical or physical method. This does not necessarily mean that those methods are not useful. However, they can only cover a certain part in a therapy concept. Cell therapy, to me, is a decisive step ahead, a breakthrough in treating patients with chronic conditions.